Indiana, like many states, is facing a crisis of poverty and a culture of inequity in which significant disparities exist for racial, ethnic, and sexual minority populations. 23% of our youth are living in poverty statewide, with 32% living in poverty in our capital city. Among our many children of immigrant families, 45% are from families in which neither parent is a U.S. citizen. On a public health front, we are facing a crisis of opioid-related deaths, and in Scott County, a recent epidemic of HIV infection reached prevalence rates more frequently seen in sub-Saharan Africa. Our goal in applying to the Culture of Health Leaders program, in the broadest of strokes, is to better coordinate upstream interventions and advocacy across the entire state to help prevent and mitigate adverse downstream health outcomes related to social and legal determinants of health.
Opioid addiction is a huge problem in Indiana, with devastating consequences for public health. Narcotics treatment programs, or NTP, are programs which involve the administration of drugs that reduce the severity of opioid withdrawal symptoms. They are controversial, but a very effective tool in the fight against opioid addiction. Jane, a 25-year-old mother of 3, was told by the Department of Child Services that she had to get off her treatment program in order to regain custody of her children. This was putting her at extreme danger for relapse. Thanks to an upstream intervention with a medical legal partnership, DCS was educated about the benefits of NTP, and Jane was allowed to keep her kids and stay on treatment. More importantly, this fixed the problem for future Janes, thereby allowing a public health problem to have a public health solution.
Jay and I have been working together for a number of years to address issues just like these. While some of our work has been unique to our respective roles in academia and legal services, we've also been able to implement much broader solutions by engaging a diversity of people with the help of the Indiana Health Advocacy Coalition. IHAC is an organization that has sought to advance their mission of enhancing comprehensive, patient-centered care in Indiana by coordinating and educating stakeholders about local and national efforts to address unmet legal and social needs that may negatively impact health and well-being. Our goals, ultimately, are to leverage our own expertise and the IHAC infrastructure to catalyze action within and among multi-sector stakeholder groups, to help facilitate a more informed and coordinated approach to addressing social determinants by expanding direct MLP services into new and varied populations across Indiana, to better position stakeholders to implement and evaluate financially sustainable, evidence-based programs, and to help mobilize efforts to advocate for change on a population health level by working toward health in all policies. Thank you for your time and consideration.